Hi everyone, this is Karen Sussman from the Professional Voice Care Center. Today we have our client Melissa with us. Melissa's been working with us for the better part of a year, training on her voice. She does have a vocal pathology. She has experienced a polyp on her vocal cord, which is what has brought her to us to begin with. She is facing surgery this coming week to remove the polyp, and she's going to be going through some post-operative voice therapy. So we wanted to speak to Melissa today, find out how her voice became this way, and let's follow her through her post-operative care and hopefully get back to a point where her old voice or even better voice has returned. So Melissa, why don't you tell us a little bit about your voice, your singing career, and how you've gotten to this point?
I always sang, grew up singing and stuff, studied, went to college for vocal performance, then decided to have my kids, had a family, and did that whole thing. Wasn't really working professionally, but I was singing regularly in a church through my pregnancies, through having kids, had no problems. After I had my second child, I had really bad TMJ, and I think my technique just went out the window, and my muscles were not strong and stuff. So then I went to the I went to a doctor, and he said, "Oh, you have acid reflux, and there's hoarseness," and I wasn't 100% on that, but he sent me to Karen, so I went to Karen, and she said, "I don't think it's just acid reflux," and so I went to a doctor that she recommended, Dr. Portnoy, who said it's definitely not acid reflux and just reflux, so among other things. So we started with therapy. We saw that there was a polyp, and we tried to just resolve it with the therapy, but did a extensive amount of work, and really helped, and I was able to get through my season. I sing professionally. So I've been able to do the gigs I need to do, but when you're singing here and you're supposed to be singing here, it's not really cutting it, and I've lost a bunch of my range and stuff like that in there, so, or things are it's a lot of work. So
right, so your effort level is up, but the result that's coming out is not where you want it to be.
Right.
Okay, would you do me one favor? Pick any vowel that you like to vocalize on, and I just want you to start at a low note and slide up so that we can see what happens to your upper range, and then a couple of weeks after surgery we'll do it again, and a couple of weeks after that we'll do it again to see what's happening in your recovery.
Okay.
Okay, so the top of the range just kind of vanishes. Would you say that your tone has become kind of breathy as well?
Definitely, yeah, definitely.
Okay, so let's check back with Melissa after surgery when she returns to our office for some post-operative training, and let's see how this turns out. Good luck, Melissa.